So primary hypertension is the number one reason for drug prescription, and like I said, it affects about high blood pressure affects about 30 to 35% of the population. Hypertension is responsible for about 70% of heart attacks, about 80% of strokes, and it's the second biggest cause of chronic kidney disease. So it has a major effect on your health. And what happens, we'll talk about some of the causes, but the reality is, as blood pressure rises in the long term, your baroreceptors, your pressure receptors adapt, or they're reset to operate at a higher level in individuals with chronically elevated blood pressure. So they still function to regulate blood pressure, but they do it at a higher mean pressure. So if you're sitting at your systolic blood pressure of 120/80, for sake of argument, okay, that's absolutely fine. As long as you're in that range, that green range somewhere, that's absolutely fine. That's nice. If you have consistently high blood pressure, so say 150/100, that is high. And if it's consistently high, your blood pressure, your baroreceptors will adapt to keep your blood pressure at that higher place. And that's not good. As we know, a higher blood pressure over the longer term increases your risk of stroke, heart attacks, chronic kidney disease, all manner of different things. And why is that? Well, if you think about it, if you have a high blood pressure, your heart has to work harder to pump against that greater resistance in your blood vessels. So as it's having to pump harder and harder and harder, your left ventricle hypertrophies or gets bigger, your muscle gets bigger. But that isn't a healthy left ventricular hypertrophy, because you do get left ventricular hypertrophy if you do a lot of aerobic exercise as well, because the capacity of your ventricle doesn't increase in this particular type of left ventricular hypertrophy, and over time it can lead to heart failure. That high blood pressure damages all that pressure bashing against the blood vessels, causes pressure damage, and can cause aneurysms, which are weak points in the blood vessels because they're continuously bashing that high pressure against them. And also it can dislodge plaques, so atherosclerotic plaques, causing blockages. So that's your MI and your strokes. And the key thing really is that hypertension, it's symptomless unless the complications occur. Treatment's quite easy, okay, or quite easy because most people take drugs, but there are lots of things that are beneficial. So a lower salt diet, very beneficial. Losing weight, very beneficial. Exercise, beneficial for most people. Limiting alcohol and smoking are also very beneficial. Things like fruit, veg and dairy, again, common sense things. Good diet also helps to keep your blood pressure regulated. And of course, worst comes to worst, as is the case in a lot of people take medications to help reduce their blood pressure. But what are some of the things that are causing essential or primary hypertension? Why do so many people have it? Well, if we're breaking it down into those different systems, if you remember, so we can break it into the cardiac responses. So what increases blood pressure? And increases heart rate and contractility. And for what will do that? Things like stress, for example. If you are stressed, you have an overactive sympathetic nervous system, and that will therefore increase heart rate and contractility. You may have an increase in your blood volume. So you may have a high salt diet, you eat lots of salts, that goes into your blood, water follows, and you increase your blood volume and therefore your blood pressure. And then you have various other causes, your endocrine causes. So increased insulin in type 2 diabetics, that insulin stimulates sodium reabsorption, water follows, and renin-angiotensin-aldosterone activation, again, will increase that blood pressure. So anything basically that activates any of these pathways, so increased aldosterone, increased arterial vasoconstriction, increased ADH, plus all manner of other things can increase that blood pressure. So with primary or essential hypertension, there isn't an evidence of a single cause of the disease. There are lots of things kicking in. But why are these risk factors what they are in hypertension? So I want you to look at this table and just have a little bit of a think. Press pause and think. Factor, increasing age. Why does that give you a risk for hypertension? What about stress? What about tobacco? What about alcohol? Why? What is the reason behind them? So remember, press pause, have a think about each one, and then we'll go through them. Okay, so increasing age. As we get older, unfortunately, our arteries become stiffer, and as they become stiffer, they can't stretch as efficiently and they can't recoil effectively. And this basically increases your blood pressure. Stress. As you get stressed, that increases your sympathetic nervous system activation. You get increased adrenaline, you get increased cortisol, which is your long-term stress hormone, and cortisol potentiates or increases the activity of your sympathetic nervous system. So this together increases your heart rate, increases your stroke volume, and increases your peripheral vasoconstriction. Tobacco. Well, nicotine. So therefore vaping will kick into this as well, and other chemicals. They cause peripheral vasoconstriction, which increases your blood pressure and causes the adrenal glands to release more adrenaline, so activating your sympathetic nervous system. So smoking, but also, though the research is less clear because vaping hasn't been around as long, nicotine is present in your vapes and it does have these effects on vasoconstriction and sympathetic activation. And finally, alcohol. Well, what does alcohol do? It increases your cardiac output. So basically it dampens down your nervous system, your cardiovascular control center, and by dampening down your cardiovascular control center, it actually increases your cardiac output. What other things can we start to think about? What about salt? Well, if you have a high salt diet, it causes retention of water in the kidneys, leading to increased blood volume, venous return, so that's the amount of blood going back to your heart, and therefore your cardiac output, so therefore your blood pressure. What about other things? Well, things like exercise. So exercise is actually generally good. Why? Because exercise long-term causes peripheral vasodilation, which will reduce your blood pressure. It increases the efficiency of sodium excretion, and it increases heart efficiency by elevating stroke volume. So it does all of these things to help in terms of reducing blood pressure. It is also important to remember that obesity has a major effect on your hypertension risk. In fact, 85% of people with hypertension have a BMI more than 25. So that kind of tells you exactly why that may be the case. And what are some of the mechanisms? Well, if you have a high BMI, especially as people get older, that tends to be in your adipocytes. So if you're a big, bulky man with lots of muscle, the BMI is a pretty poor measure. But if you've got a lot of extra fat tissue, that's a major source of angiotensinogen. So with that obesity comes an increase in your angiotensinogen. That angiotensinogen means you get upregulation of your renin-angiotensin-aldosterone system, and that of course leads to fluid retention, vasoconstriction, and therefore hypertension. But at the same time, obesity causes an increase in your noradrenaline levels, so therefore it activates the sympathetic nervous system, and by doing this it increases your heart rate, increases your stroke volume, and therefore increases your blood pressure at the same time. Finally, with obesity, though there are lots of other mechanisms, with obesity comes insulin resistance. So basically your adipocytes produce a variety of chemicals that cause insulin to not work as well. And so because the insulin isn't working as well to regulate blood glucose levels, people who are obese will make extra insulin and release extra insulin. And that leads to hyperinsulinemia. So that's increased insulin in the blood. That's the emia bit. And insulin causes sodium retention in the kidneys. If you've got more insulin, more sodium retention, and therefore more blood pressure. So there are lots and lots of reasons for obesity having an effect on blood pressure. And of course, another one is obesity also leads to an increase in your LDL. So that's your low density lipoprotein. That's your bad cholesterol that you might have heard of. And that leads to your atherosclerosis, so the clogging or the furring of your arteries, leading to that lack of vascular compliance. So that's their ability to stretch and stuff and recoil, therefore again increasing blood pressure.